Hello, I'm Nicky Wilkins, the Consultant Midwife at Hillingdon. We're going to answer some of your Facebook questions today. If you or your baby unwell, I'm going to split this into two sections. So if it's you that's unwell, please contact Maternity Triage or Accident and Emergency in the first 28 days. If it is your baby who's unwell, please contact Accident and Emergency, and that's for urgency, for urgent cases. If it's non-urgent, you can contact your GP or 111 if it's appropriate. We've had quite a few questions about changes to appointments, so I'm just going to highlight these into a big section here. If we need to change your appointment, we will either contact you urgently by phone or non-urgently by letter. If you want to change your appointment, then please contact us on the number we'll show at the bottom. If you need to reschedule your appointment, again, please contact us on that number at the bottom. We do have interpreters available, so we can use those if needed, if English is not your first spoken language. At the moment, we are not changing our visiting policy because of COVID. We are keeping our visitors to a minimum. We will, of course, update you and put information on the Facebook page, on our web pages, as soon as this situation changes. If you access our Mum and Baby app, there's a section there, Getting Ready for Your Baby, and it's got a full list of everything you should need for your hospital admission. If you've got any concerns about that, please speak to your community midwife and they can advise you about the Mum and Baby app. Of course, your partner can leave the labour ward to go and get food or to refresh themselves. We do ask them to keep this to a minimum as we're trying to reduce the footfall in and out of the labour ward to prevent spread of infection. Our discharge policy hasn't changed. We will try and arrange your discharge with you in the time that suits. For women who've had a normal delivery, you can normally go home within about 6 hours. For women having operative deliveries like a caesarean section or probably an instrumental delivery, you're possibly looking at 24 hours, although that can be discussed with you on an individual basis. You will be contacted on the day after you've had your baby by our community services. If it's your first baby, it's likely we will visit you on that day at home. If it's your second or subsequent baby, we might discuss the visiting arrangements with you and make an individual plan as what best suits you. If you have any more questions, please feel free to post them on the Facebook page. We try and answer them on a regular basis, normally every day, and we're happy to answer any question you pose to us.